Hello, hello, and welcome to the Feeding Pod. This is your host. I'm Brianna Millick, and I am a speech language pathologist and certified lactation counselor. I specialize in infant and medically complex feeding and primarily see patients in the home health setting, although I do have some that I see in outpatient or via telepractice. I'm also an instructor at the university level and a PhD student studying communication and information sciences. I have a huge passion for evidence-based practice and supporting information literacy in speech, language, hearing, feeding, swallowing sciences, specifically as it pertains to social media and translational research. This podcast is meant to share anything and everything related to being a pediatric feeding SLP, feeding therapist, with sprinkling in a little bit about working in academia, being a PhD student, and how to access, appraise, and implement research into clinical practice. Some episodes may contain guests, and I'm already looking forward to some of those coming up, while others might just be me rambling about something that's been on my mind. Regardless, my goal with this podcast is that you walk away not just with newfound knowledge, but with the inspiration to think critically and not be afraid of research. So without further ado, let's get into today's episode. Welcome back to the Feeding Pod. I am Bree, and I'm so excited because today I have Cassidy Arvidsson with us today, and she is going to be sharing about her lived experience as someone with ARFID. And if you're not familiar with ARFID, don't worry, we're going to go through all the ins and outs of formal definition, all that stuff, but also what it's like living with ARFID, how her experiences have been, her past experience with therapies, what it's important for us to know as clinicians. And yeah, I'm so excited, and I'm so grateful that Cassidy has agreed to share this with us, because I think these lived-in experiences are so important for us to better serve our patients and our families. And yeah, so Cassidy, I'm so happy you're here. I'm going to pass it over to you to kind of give us like the quick synopsis of like, who is Cassidy?
Thanks so much, Bree. My name is Cassidy Arvidsson, and I am 26 years old, and I've actually had ARFID my entire life. So this is a big part of my world and my reality, and I'm super excited that Bree asked me to be a part of this. It's my first appearance outside of my own Instagram. So I'm super excited to actually be moving forward and just spreading more awareness on ARFID, because it's something that is really, really important to me. And I've made it my mission now that I wanted to spread so much awareness about ARFID. So I'm super excited to be here, and yeah.
Awesome. I love that that's your mission, because, I think, we want to make sure not to put too much responsibility on people to share your lived in experience, but it's so powerful to know. And I know that a lot of what you share is to help validate the feelings that others have with ARFID, but I hope you know that as a clinician, as a feeding therapist, it is so powerful for me as well. And it helps me better understand the clients that I'm working with. Now, primarily work with pediatric feeding disorders, not ARFID, but it's really important for me to understand that delineation and also recognize where I play a role and where I don't play a role. So I'm really excited, and I appreciate you sharing all of the things. And before we kind of get into some of your experiences, can you just kind of help explain to people, what is ARFID? What does ARFID stand for? What's kind of the formal definition? So we can all start on that same base level of definition.
Yeah, for sure. So I actually looked up the formal definition of ARFID because I didn't want to mess it up. So ARFID is an acronym that stands for Avoidant Restrictive Food Intake Disorder, which is a less commonly known eating disorder that, in summary, is a complex eating disorder categorized not by issues with body image or weight gain, but by extreme fears or avoidance of foods because of their taste, texture, smell, and or other factors like overall disinterest and or low appetite surrounding food.
Yeah.
Was that good?
No, that's perfect. And I'm glad you brought
that.
up the fact that this is an eating disorder. And I think I as a feeding therapist want to emphasize that point, because this is different than a pediatric feeding disorder or picky eating or something related to a feeding skill standpoint. We are thinking of it more from the psychological piece, right? So talking about sensory differences or anxiety surrounding that. And it's very different in how you're going to approach, supporting someone with ARFID. So I'm really glad that you brought that up. Okay, so now that we have like the formal definition, right, the boring part, how would you define ARFID? Like in your own words, how would you like kind of bring that description together for how your experience has been?
Yeah, no, for sure. ARFID shows up differently for everyone, which everyone you're gonna hear me say that a million times throughout this because it is so, so true. ARFID is literally so different. I've not met another person with ARFID who has shared the same experience as I. So I just want to make that clear throughout, like, as we continue it throughout the podcast. But because it shows up differently, obviously the answer is going to look different to everybody. But for me, ARFID is overlooked, misunderstood, and much, much more than picky eating. It is so and very much classified as picky eating, and that you're just going to grow out of it. And I just want to be clear from the start that it is more than picky eating if we actually are dealing with ARFID.
Yeah, I'm so glad you brought that up because there is a difference between pediatric feeding disorder, ARFID, and picky eating. Like they are vastly different. And, that's kind of part of a role as a feeding therapist is to help navigate and figure out which ones that you can best support that. I'm also glad though that you brought up like being overlooked and misunderstood. I think misunderstood probably is going to be, a common theme, especially like as you're sharing, like based on my lived experience, I feel that
Mhm.
ARFID is misunderstood. And so I'm really excited to dive into that more. So hopefully people can leave here better understanding what exactly ARFID is. Now, you had mentioned it shows up differently for everyone, right? And I'm sure that's true within all aspects of ARFID, but are there sort of different types or categories sort of ARFID that can better help people understand? Maybe like, again, we're talking themes here. Of course, each experience within it is going to be different. And, that's
Mhm.
always valuable information with each client that you're working with. But could you give us a general overview of those different types?
Yeah, so there so yes, that's definitely true. There are different types of ARFID, and there are three main subtypes of ARFID, which are avoidant, aversive, and restrictive, but as well as ARFID plus, which can be any of these subtypes of ARFID plus a coexisting eating disorder like anorexia. And then I can go into like what exactly those three categories are. The avoidant ARFID subtype presents itself as one who avoids certain types of food based off of sensory features, leading to sensitivity or overstimulation reaction. They may feel sensitive to the smell of foods or textures, appearance, or foods that have a certain color. So that's avoidant. There's also aversive. Aversive ARFID evokes fear of choking, nausea, vomiting, pain, and or difficulty or issues with swallowing. This forces the person to avoid food altogether. And then lastly, for the main subtype of ARFID, restrictive ARFID may show signs of little to no interest in food in general. One may forget to eat altogether, show signs of low to no appetite, or get extremely distracted during meal times. Other symptoms include pickiness of food, leading to limited intake and variety. But it is important to note that all of these subtypes of ARFID, that it is not uncommon to have more than one subtype of ARFID. Me personally, my ARFID shows up in both the avoidant and restrictive subtype. But I just want to say your ARFID is real and valid if you have all or just one of these subtypes.
I'm glad you brought that up because that was a question I was going to ask is like, even though we have these, variations and types of ARFIDs, it can overlap. So there's that
Mhm.
where it's like, okay, I could have just one type of this ARFID, or there could be an overlap of all three, of two of them. So I'm glad
Mhm.
you clarified that. That's helpful. I feel like for like my experience as a clinician with ARFID, the one that I see the most, which I know you said is not necessarily like the like biggest subtype, is actually the aversive ARFID because of children that may have had a pediatric feeding disorder. So they had something medical going on that made swallowing difficult, increased risk of choking, made them feel uncomfortable when eating. And even though that medically has been managed, they will continue to show those aversive behaviors of like, I'm scared. I'm scared
Mhm.
that if I eat, even though, some of those things have been managed or resolved. I'm thinking about specifically with patients that have had like eosinophilic esophagitis, like doesn't feel good in the esophagus. And even though the EOE is being managed, they're still really nervous about eating some of
Mhm.
those foods. And so, and then of course the avoidant and restrictive, I've definitely seen versions of those as well, but I find it from a pediatric feeding disorder to ARFID, I find like that's sort of the one that it almost like will
Mhm.
manifest on after. Because some kids, it's like, oh, medical management's under control. I'm good. I can just start eating. But I've had some kids that are like, I don't want to feel bad. I don't want to choke. I don't want it to hurt. And so that will still kind of hang out there. So I'm glad you brought those up though. That is honestly something that I learned from your page with ARFID is like understanding ARFID, but then realizing that there's these like different types. So, okay. So we have a good sort of foundation. What is ARFID? What are the types of ARFID? How to define ARFID? So now I would like to know more about your experience with ARFID. So let's start out. When did you first notice that you were having feeding difficulties? Or maybe because you had mentioned it had been your whole life, when did your caregivers first notice that maybe you were having some feeding difficulties?
Yeah. So when did I first notice? This isn't the case for everyone, as I said, because everyone's ARFID does develop at different times and for different causes. But for me, like Bree said, my ARFID, I was practically born with it, is what I like to say. I don't even know if that's like an actual, like confirmed possibility, but it seems to be. So I'm just saying it is. But growing up, I had always been labeled as an extreme picky eater and was told I would grow out of it. But here I am at the prime age of 26 and still eating the exact same foods that I was eating as a child. I believe the case of my ARFID actually started in utero slash like during my birth, actually. My mother didn't know that she was pregnant with me for most of her pregnancy. And this is because she didn't show, like, there was just no belly, there was no baby to be seen. Um, and because there was no belly, there was no amniotic fluid in the placenta. So I was just this little dried up little raisin hanging out. And so when I was born, or when it came time for me to be born, they guesstimated me roughly like premature, but that's just like a random side fact. So when I was born, the umbilical cord was actually wrapped around my neck, my head, and my body, and was causing like difficulty in breathing. Obviously, any trauma to obviously the neck, the head is going to be traumatic, which obviously, so this traumatizing to me as an infant. And I like to note that like the body does remember trauma. I don't know I'm not informed a lot about like the body remembering trauma, but I definitely do believe that that's a real thing. And just like all other eating disorders, they develop subconsciously. So that's kind of how I believe that my ARFID kind of came about. And because it's just always been a thing when I was a toddler, like I didn't like candy as a kid, I didn't like juice, like all the things that like kids are like, "Oh my god, I want to live on this lollipop for the rest of my life." That was not me. Now, I did have obviously safe foods and I just continue to eat those to this day. So, I don't believe it's anything that I or anyone did to me for this to develop. I believe that ARFID typically develops, like I said, through some sort of trauma, whether that be big or small, in quotes. That's not really up to like us or even relevant. Some people, like, I don't know, they're just like, oh, like someone from the outside can see it as like something small, but it's really not small. Like the body, the size of like the trauma doesn't matter is kind of what I'm trying to get at. And I just want to say that ARFID is not a choice. I have a lot of people who say it is a choice. It's just like picky eating. And that goes to say like with all eating disorders, I try to be an advocate and like just conscious of like all eating disorders that I'm aware of, not just ARFID, but I obviously speak more personal to ARFID and just like informing people that I have no memory of my life without ARFID and the limitations of my ARFID and what that's kind of like capped me on. It's just kind of always been who I am. And sadly, I fear that it will always be who I am, which because it's just so limiting in like so many aspects. And it's not something I want at all. And so, yeah, that's a little bit about like the backstory of kind of how my
Yeah.
ARFID developed and all of that.
Yeah, no, that's super helpful. And I think that, like you said, ARFID is very, very different for everyone. And I'm so glad you brought up the trauma being big or small, and how like someone from the outside would be like, that's nothing. What do you mean? Like, just kind of,
Mhm.
get over it or whatever. And it's like, that's not how it works. I always like the phrase that trauma is perception. So like a big trauma
Mhm.
to you might be a small trauma to someone else, a small trauma to someone, maybe a big trauma to you. And that's why it's based on that internal perception. There actually is a book, if you haven't read it yet, called The Body Keeps the Score.
I've
And
heard of it, yeah.
it is very good. It's good. And it really talks about how trauma can manifest in the body, within the body. And so, even something like you were saying, that like a trauma in infancy may have presented itself in a way that the body kept the score, and then it
Mhm.
manifested as these difficulties with eating and experiences around eating. I'm glad that you brought up too how you said, this has kind of been my own life, but I also sort of fear that it always will be, because there are these
Mhm.
limitations around it. And I think that, we're gonna talk a little bit about what's been helpful or not so helpful with, your journey with ARFID.
Mhm.
But I would love to, and I definitely did not send you this question ahead of time. This
No,
popped
that's
into my
okay.
head though. But I feel that with ARFID treatment, there is, and we talked about this a little bit before we hit record, but there's a piece to it where there has to be some internal motivation to say, okay, I want to expand my variety a little bit, or I want to engage in this exploration. And I'd love for you to just speak on that a little bit, and how maybe like at this point in your journey with seeking support to kind of, work on whichever pieces of ARFID you want to work on, may have been different than if you had been placed in therapy as a child who maybe was not interested in expanding your diet variety at that time. I would love to just hear your take sort of on that, because I think that internal motivation is a huge part of like, honestly, like ethically, if we should be providing treatment. So
Yeah. Yeah, no, I honestly, I kind of hold some resentment to just like my caregivers, my mom, my dad, the people who were just caring for me as a child, because I would have really liked, well, I can't say like little me would have been like, "Oh, so willing to do this," but it's just I currently as an adult I hold a lot of resentment towards like not getting some type of treatment or something when I was younger. And you do have to have like a sense of, there has to be a sense of willingness if you want to move anywhere in like the direction that you want to move in with RFID. Like if I want to have less limitations with RFID in the sense of like the food itself, like if I want to have a wider variety, I have to have willingness to face the fear over and over and over and over again. And that's not something I'm currently interested in, even though that's a life that I really, really want. Like I would love to be able to go on a first date and just have him pick a restaurant and we just go. That's not something that I'm able to do. And I wish that I could have like done more work as a child, but I didn't even learn about what ARFID was until coming up on 2 years ago now. So that's I hope that answers the question, but
yeah, no, that's so helpful, because I think that, it kind of reflects on this like balance where, let's say that you were, really, really little, that you were, 6, 7, 8 years old, probably not recognizing, like any of those limitations or impacts you're thinking about. But maybe
Mhm,
had you been told what ARFID was in late middle school or high school, you would have been like, wait, I would like to investigate that more. And I also think too, having that, I'm sure, and I'd love for you to speak on that more too, of like finding out about ARFID 2 years ago, like how validating that must have felt, of like, wait a minute, it's not like a quote unquote problem with me. Like this is a
mhm.
thing. This is real. And I can only imagine that that was super helpful. And maybe that will kind of, transition us into this next part of like, what part of your journey has been helpful and your experience with ARFID, finding out what ARFID is, and any of the treatments along the way as well.
Yeah. So what's helpful, again, varies from person to person. But ironically, like I said, I didn't even know ARFID was a thing until just coming up 2 summers ago, and I was literally in the exact room that I'm in right now, and I was on YouTube, And I had I think I was researching 'cause ARFID was originally, like, kinda categorized as selective eating disorder, so SED, which I had explored that, and I also had explored neophobia because I was like those were kind of, like, the 2 pillars I was like, I'm resonating a lot with these, but not, like, fully, and then it kinda suggested a video of and I'm sure we can, like, get the resources for this video because it was amazing for how informative and direct, but, like, easy to understand this video was, just
Yeah,
like,
if you
what is
find the
ARFID?
link, refine the video, we'll share it in the show notes.
Yes, perfect, okay. And I just watched it, it's like a 10-minute video, and I literally remember I was crying, and I texted my best friend when I watched it, and I sent it to her, and I was like, "Oh my god, this is me." Nobody could tell me that this is not me because this is so me that, like, I feel like I could have made this video if I understood myself at that, like, way. So, that was a really monumental moment for me, and so that yeah, that was 2 summers ago, and I mean, that made me 24 years old, and so I've been living my life up until that moment just believing or just honestly just gaslighting myself that, like, I'm just a picky eater and I'll eventually grow out of this, but I in my head, I'm like, that's not gonna happen, like, I don't know how to put this into words, so that was that was honestly it was a big moment, and I've turned my life in, like, a different direction of, like, what I want, what I need, and just, like, getting the people around me to understand this and just feel validated. I'm big on validation in all forms, but, especially when it comes to this, just because I spent so much of my life feeling invalidated, but, like, not knowing that there was a way for me to be validated, if that makes sense.
No, it
Um
does. I feel like that it and correct me if I'm wrong. I don't want to put words in your
Mhm,
mouth. It's almost like it gave you the language to explain what was going on. Like you're like, not
100%.
only do I feel validated that like there is, a diagnosis that like makes sense for how, I experience food, but it also gave you the language to advocate for yourself and to then say, okay, now I can find supports that I need. Now I can like better help myself, even like personally. Like, okay, I don't have to gaslight myself into thinking that like I'm just a picky eater and like why can't I just get
Mhm,
over this? And actually saying like, no, like this is real, and this is different than being a picky eater.
yeah, and I think, like, for more, like, concrete, like, what has helped me with, like, my ARFID, there's a few things. One thing which I didn't even put in my notes, it just came to me, is community. I mean, this is big in, like, all aspects of, like, life. Community really, like, just having ARFID is really, really lonely just because it's so, like, such a I don't wanna say it's a small thing, but, like, the people are unaware. Everyone's unaware of what it is. It's not uncommon that I run into someone and they're like, "What is ARFID?" This is my first time hearing of what ARFID is. So, I think and that's a big reason of why I, like, created my profiles, my Instagram and my TikTok, but so just having a sense of community and just, like, understanding even though my ARFID is I've not found someone who has my exact ARFID, like, my exact safe foods, my exact blah, blah, blah. I just having a sense of community is really, really helpful, so definitely that's one thing. Another thing is I personally struggle a lot with low appetite and just overall disinterest in food, and in these moments, I struggle the most. That's when, like, I'm just like, I don't know, I'm just not doing well when those, like, moments are high because I just quite literally don't want to eat, and not for the reasons of, like, weight loss or because I'm, quote, unquote, "I'm not hungry," but because I just hate eating. Eating has never been a pleasurable thing for me. It's simply a chore. Every day when it comes to lunch, I'm like, "Oh my god, I have to eat lunch." And that's just exhausting. So in these moments, the most helpful thing for me is having a list of foods that I know to be safe. And Kevin does ARFID on Instagram actually just made a post about how to do meal mapping and kind of to give a breakdown of like how to create a list like this. And I've not even made a list like this. So that is definitely something that is really helpful. Just having a list, however you want to create it, and just having easy reference to food that you know to be safe. You can simply look at it because another thing that people with ARFID struggle with is like we get very overwhelmed just because we have such like disinterest in food that we're like overeating. Like I've had ramen so many times. I'm like, I cannot have any more ramen. So let me go to the next best thing that I know. But sometimes you forget about like your safe food. So having a list is super, super helpful. And then always having snacks. Snacks. If a snack has to be a meal, then that's just how it is. Snacks are often, well, snacks in quotes, because I feel like a snack is just like the term snack is like small amount, but like you can make a snack food just like larger. That's what I do. Like I have goldfish for breakfast like every single morning. So just always having some type of snack food or something that's super easy to eat with you, and just having that to eat is honestly what's helpful for me in my ARFID at this time.
No, I love that because I think it's sort of like twofold the things you're talking about. One is validating that like the foods that are safe for you are okay to eat at any time. It doesn't have to be a
Mhm.
snack. It doesn't have to only be in a very small amount. Like if goldfish is the choice of the meal, like that's okay. And kind of like
Mhm.
helping with some of that, self-acceptance piece of like, it's okay to eat the foods that I want to eat. But I also appreciate you bringing up that list example because I think that it's sort of like if you're, I'm reflecting, I don't have ARFID, but if I'm reflecting on moments where I'm feeling overwhelmed, you know, I don't want to make a decision right now. I can't think critically. I can't like
Mhm.
go through the steps of something. And so having that like actual visual of like, these are a list of foods that are safe for me. And if you've had, for example, ramen multiple times in a row, it's
Mhm.
like, okay, well, I also want to be careful that I don't like, jag myself on a food. I don't get a food jag. And then all of a sudden I don't like ramen at all. So like, what's another
Mhm.
one I can rotate with without having to think like too critically? It's like, no,
Yes.
they're right here. I can grab it. It's fast. It's convenient. Because I think too, where you mentioned like eating being a chore it's just like something you have to do. I can imagine that makes wanting to be involved in excessive cooking recipes like just like no thank you.
Mhm.
And that's something that I've seen actually ARFID dietitian share, which she's going to be in an upcoming episode talking, where she's like talking about like convenient foods, like things that you can put in the microwave, things that you can open and eat immediately, that can alleviate some of that like feeling of like, this is a chore and I just don't want to do it. And so
Mhm.
instead of saying like, well, I don't really want to do it, I'm just not going to eat it all, having those like other convenient options, which kind of makes me think of your like just having those little like safe food snacks around to be
Yep.
helpful.
I always have goldfish in my purse or my bag. If I got a tote bag, like I live in New York City, so I've always
Mhm.
got a bag of some sort, whether it be a tote, a purse, whatever. There's always goldfish in there. Like I've gone to literal formal weddings with my purse and inside was goldfish. Like
I love
they
it.
are always there. So, and if that's what you have to have, like, then that's just how it is. And I think now the acceptance of that is a lot harder, but I think just like doing that act and having it available is really, really important.
Mhm. I love that. Okay, so kind of getting into a little bit maybe more of the more difficult topic of like, what are some things that you've heard or felt or seen that are just not helpful as you're working through this journey?
Yeah. Again, this is going to vary from person to person, but I found that in my experience, and we kind of touched on this a little bit earlier, is that food exposure therapy is just not helpful for me, at least not right now. It's something that I really, really want to work towards, and I've tried it multiple times. I've even tried doing like hypnotherapy. I've done hypnotherapy for my ARFID. Even before I knew it was ARFID, I was just like, I can't eat like an orange. Why? Like, and I've had little successes and like less anxiety when I did like the hypnotherapy, but I mean, here we are in this exact moment. I'm not able to do them. So that yeah, exposure therapy is just not something that I'm really interested in doing right now, and it's not helpful for me, but it can be helpful nonetheless. But like I said earlier, you really have to be willing and open to put in the work because it is a lot of work. It is a lot of emotional work and it's a lot of acceptance work. It just results in a lot of anxiety. And I also find it to be a little humiliating after the fact. Like once I've calmed down from my panic of trying a lick of some non-safe food, like example, peanut butter, I get embarrassed thinking about how ridiculous it was that I got that worked up over something that in reality seems so small. But I do my best to remind myself that although this fear may seem irrational to others and even to myself at times, that it is valid and true. And I, of all people, should not be the one making myself feel bad for a subconscious reaction that my body is experiencing in order to simply protect itself. My brain believes it is in danger, and fear is the body's way to protect itself. And I must remind myself of this when I'm doing food exposures, although I don't do them often.
I'm so glad you brought that up because I think in the feeding therapy world, like food exposures and like desensitizing clients to foods is like the go-to. And I
Mhm.
really think that we should be reflecting a lot more on supporting the self-acceptance and
Mhm.
advocating for needs and validating the feelings. Because unless somebody comes to me and is like, all right, teach me the tools, tell me what I need to do to be able to like expand my variety. And even then it's like, okay, here are the tools. Now you go. It's like it's
Yeah.
also not something that I need to be like checking in every couple days. Like, did you do it's like, no, here are the tools, and I want to equip you with those tools. But more than anything, I want you to feel validated. I want you to have that self-acceptance and understand like I need to advocate for my needs or making those adjustments. I actually had a conversation yesterday from when we're recording this with a parent where I said, if your child is having difficulty and like if we go to a wedding, it's crazy that it was the same situation where you're like, okay, that's going to be an overwhelming situation. Who knows what they're going to be serving? And you
Mhm.
say, you know what? I'm going to make sure my child is fed before we go. And I'm going to bring a safe food there so that they can enjoy the event more than anything. That's being intuitive and attuned to your child's needs. And like,
Yeah.
that is not something to feel shame about. And like, that's exactly what we want to work toward. And when the child says, hey, I'm ready to like try a new food and I want to go into that, I just think that, those are the things I think that matter much more long term than like you said, like, okay, I tried the exposure and like, guess what? A year later from trying that, it's like, nah, nothing stuck. And it's because it's hard. It's really hard work. And but also recognizing like it's okay if you don't want to do it. Like that's absolutely
Mhm.
okay. You can still be well nourished and get all the things that you need in a safe way that feels safe for your body. Because like you said, it's like my body
Mhm.
subconsciously is saying this isn't safe. And
Mhm.
that's your body protecting itself. So
Yeah. I like that you said or just brought up how the self-acceptance, or just like acceptance in general, and just feeling safe around that and validating people in their experience. I think that because that in like return, I think is going to be more motivating for the individual to want to do food exposures. Because I feel like if I example, peanut butter, if I am doing a food exposure with peanut butter and it took like 45 minutes for me to do one tiny baby lick of peanut butter, I'm already going to feel discouraged, humiliated, panicked, and even though I may have done like one little lick, it feels it doesn't feel like a celebration. And so I think working on the self-acceptance and just like yeah, just working on self-acceptance, I think is going to be the most motivating piece when it comes to moving towards expanding the variety. Because everyone's goal, whether you have ARFID or you just want to expand your variety in general for different reasons, maybe you have, I mean, I don't know the pediatric one, but I don't know the other struggles, but I'm sure that there are. And I think the main goal should be just like motivating the individual to get to the end result. We can't start where the most challenging part is. So I think that's really important to
yeah.
highlight.
No, I'm glad you brought that up. It's like that is the most challenging part. We don't just skip to that. There's so many other things that we have to support first. So thank you.
Hmm.
Okay. So if there are any caregivers, parents who may be listening in, what is something that you would like to share with them that you would like them to know or hear about that, maybe have a child with ARFID?
I love that you have this question in here because I never really think about this. I actually have a lot of parents who DM me or like comment on my videos and are like, "Oh my god, my 7-year-old like literally only eats potato chips and Cheetos." And like I want to help them, which I love that they found my page, they're aware of what ARFID is. Like that's the first step. So I think that's mainly what I'm going to be talking about is like educating yourself on what may be going on. It may not be ARFID, but it may be ARFID. And the first step to actually helping them is to get educated. So what I would suggest is to actually listen to what your children are saying and feeling about food. Whether that could even be like in like a good reaction, like they could eat something that they like. Explore why they like that. What is it like? What is the sensory experience of that? Or just exploring how they're feeling and what they're saying about food, good and bad, and then respecting their boundaries with food and exploring the fears if they have them. And respecting their boundaries is really, really big. I feel like I know I can speak to personal like experiences where like as a child, like, oh, I I was given these green beans and I was like, absolutely not. Like I will not eat these green beans. Like, no. And I was saying, "No, like, I'm not eating these green beans," and respecting that they don't want to have those green beans or whatever it is, and just I think showing, especially at a young age, like, just respecting boundaries in general are really, really important, and that the force feeding should never, ever be the first answer, and that may be controversial, I don't know, but I have been force fed, and it only causes more issues. It just instills more fear, it gives
100% agree.
resistance.
Yeah,
Yeah.
I'm a hard stop on that. Absolutely should not ever.
Yeah,
Mhm.
it's traumatic. Like, the green beans example is literally I have such a vivid memory of this because that was traumatic for me because I was force-fed green beans. I was told, "You will sit here until you eat these 2 green beans," and I sat there for, like, an hour, and then I did not eat them, and then my my grandma literally fed them to me and, like, and it was just like, that's never should be the first option, or even I don't even know if it should ever be an option, but I mean, there are more extreme circumstances that I'm sure where it could be a possibility. And then also understanding that all food has nutrients, all food. I hate we have like a hierarchy of food and that this food is healthy and this food is unhealthy. I hate in my personal life, like I'll have friends who will literally be like, "Oh, all I eat is junk food," or I hate the term junk food. No, a salad and a potato chip and a sandwich on white bread, they both have nutrients that your body needs, and it is important to have a balanced meal, but a balanced meal looks different for everybody. And
I I had sorry to interrupt
no,
you.
you're good.
I took the course RDs for neurodiversity with Noreen Hunani, and one of the quotes she said was that she was like, "The body knows nutrients, not recipes." And she's like, "They don't. The
Mhm.
body doesn't know the difference between a Dino chicken nugget and like chicken that's on like grilled chicken salad. Like it just
Yeah.
knows the protein in the chicken, like and the sort of
Mhm.
difference there, or like it doesn't know the difference between a certain vitamin in or like a supplement or a shake or some type of drink you've made as compared to like the raw vegetable." And
Mhm.
I just think that that's so important and validating because like food doesn't have morals. Like food is just food, and I love that you
Yeah.
said like a balanced meal can look very different for each person.
Yeah. No, I'm glad you brought that up more because I had seen a TikTok or not a TikTok, an Instagram post about like, yeah, chicken can look like dino nuggets or it can literally look like a gourmet meal prepped 5-star. I like, it's all these things. So, like for me, I quite literally grew up on like I packed my lunch every single day as a child. Every day I brought my lunch from the time I went to like start of school to the time I graduated. I packed my lunch, and every single day I had crackers and bologna and probably another bag of chips. Like, and I that's just like how it was for me. And for me, I've been lucky. I've always had stable vitals. I've not really had any huge, like major health concerns. But I think that's important to like note that like I didn't grow up with a balanced meal and I just was fed. Like I literally just ate enough of what I liked And that was enough to keep me going. And I've yes, I've been small my whole life, but like my vitals have been like healthy, which is the most important. So just remembering that eating something over nothing is always, always, always better. And last but certainly not least, get curious and get educated on ARFID, as well as just all eating disorders in general, eating disturbances. They're really, really important and they're much, much, much more common than you would believe. So,
Yeah, I appreciate that, and kind of bringing to light that, this is something that is a newer diagnosis. And so part of that is just getting educated, becoming more aware of it, as caregivers and professionals, so that we can better identify and help people get the support that's actually going to, you know, um, make them feel validated and hopefully support those long-term changes in a much more positive manner.
mhm.
Okay, so if you are talking to someone who maybe has ARFID who's listening to this episode, what is something that you would like to share with them?
Yes, I love this question. And it was so fun like exploring this because I was like, what do I really want to be saying to these people? Because I am one with you if you're listening. And honestly, it's just don't be afraid to ask for accommodations. For the longest time, I mean, I didn't know I had ARFID until 2 years ago, but I was so scared to ask for accommodations. I've always been like, oh my God, I can't do this because I won't be accommodated, or just, yeah. So I had a friend last summer who I told him about my ARFID and everything, and he he would like just walk me. I would always bring my lunch with me somewhere, and I'd have like leftovers that were cold. I have an ice pack in there, I'm ready to eat. I just need it warmed up. And he would just walk up to some restaurant, literally random in New York. Hey, you got a microwave in here? I know you do. Could you warm this up? She has dietary restrictions. She just needs this warmed up. Could you pretty please? And they always say yes. Like, I think finding the confidence to just ask for your accommodations, whatever your accommodations are, it's important to ask for them. And I know it can be scary to take up space in this world. And even more so, I know you don't want to feel more like an outcaster than you probably already do. Because I know I already feel like an outcaster having ARFID. And then I have to point it out to this individual when I'm asking for accommodations. But you deserve to live a life that is as fulfilling as other ableists get to do. Kick the shame and the guilt to the curb and bring your cute little lunchbox with you everywhere you go. Okay. Last summer, like I said, I started doing this and I've slowly started to gain more confidence in accommodating myself in ways that I know are helpful and increase my quality of life. Because when I really start to think about like my RFID, the biggest fear I have is losing my quality of life. Like by my limitations. So I think we really just need to pay attention to accommodating ourselves and asking for it, because that's the only way. If we're not if food exposures are like not something you want to do, the only way that I believe you're going to be able to increase your quality of life is to accommodate yourself and make others accommodate. Well, not make, that's a little aggressive, but like, ask for them, encourage them. And if someone won't, then do it for yourself. So just bring your favorite childhood snack to work, or whip out your bag of goldfish on your first date. Like I said, I did it at the wedding. You're valid and you're seen by me. And together we are going to make a difference, not only in the ARFID community, but in the world.
Oh, I love that so much. And I just appreciate you sharing all of those. And I hope that anyone listening feels so much more validated in it, but also recognizing like it's hard, you're sharing like it's really hard for me to bring my lunchbox places. It was really hard because unfortunately the society we live in is super stigmatized toward, people with disabilities and differences. And that makes it even harder. But I think, the more that you can say, I'm advocating for myself and I'm requesting this, that the easier that it will get, but also the more awareness it brings to people that there are differences in food experiences. So I'm so glad you brought that up. Okay. Last big question is, what would you say to clinicians or physicians about ARFID? What should they know about it? Yeah, I would like to know what you would share with us.
I want them to simply just take the time to get educated. And I know that's like so general, but it's like nothing more that I can ask for, because once you're educated, you become more curious. And then it just, in return, gives the support to the people in need. ARFID was officially declared an eating disorder in the DSM-5 in 2013. 2013. I know you guys know what year it is. It is 2023. It has been 10 years since then, and little to no providers know anything about it. Literally, they're completely clueless to even the acronym, the term. It's honestly, it's really invalidating going into a PCP office or even an eating disorder specialized clinics who have little to no knowledge of what the disorder actually is. They'll look it up by definition, but do they have the actual knowledge within their own brain to be able to support you? Because a textbook isn't going to support me. It's going to just teach you about a term. That's pretty much what textbooks do. And then when you go in, you often get misdiagnosed with something else because there's the lack of education and awareness. And then that can lead to other traumas. I have heard other people on comment on my Instagram, DM me, all this stuff saying that they were misdiagnosed, and now there's even more fear and there's even more like issues because they've been invalidated for so long. They got treatment for something they never even had. So that's mainly that. But I think that the need for support for ARFID is out there. There is a big need for it. Rightfully so. And there's so many people who have ARFID that don't even know that they have ARFID. And the few resources that are out there, invest in them. Get curious and get educated. And then I also want to shout out the providers who are dedicating their life, their time to supporting those with ARFID. I thank them. Lauren, my dietitian, ARFID dietitian on Instagram. She's amazing. If you ever have the chance to work with her, I know she also does ARFID support groups for caregivers and for individuals, adults. So that's a little shameless plug right there. It wasn't in my notes.
Okay, I love that we didn't even realize until we talked today that Lauren is who I am going to be talking with later today, actually, and her episode will be coming out right after yours. So I just think that's such a small world connection, which also shows how small the ARFID community is.
Really, it is. It is quite small. I kind of know of, I don't personally know them, but I do know of the major ARFID providers and supporters who are out there and are making a difference. And I just think that they deserve a shout out because they're really making a huge difference and making milestones of hopefully a changed future that really benefits people with ARFID. Another thing that I wanted to point out and just ask is if you are a physician or a clinician and you want to get educated on ARFID, really hone in and explore those who have lived experience with ARFID. So just listening to this podcast in general, it's already a great start. But there are other people on Instagram, on TikTok, and on maybe other platforms as well who are sharing their lived experience with ARFID online. And just get curious about that. Ask them questions because, like I was saying earlier, no textbook is going to outweigh the knowledge you'll gain from lived experience. So that is what I wish of the providers and the professionals out there. I would just greatly appreciate that. And I know the ARFID community would as well.
Yeah, I love that. And I'm glad that you emphasize the importance of learning from people with the lived in experiences, because like you said, a textbook can give you the definition. The textbook could give you kind of the hard facts about this is a pretty good treatment to try for it. For example, desensitization exposures tends to be pretty far up there. Cognitive behavioral therapy, those are the things you're going to read about, but that's not what's going to make the lasting difference. And that's not always what's needed to support a person's quality of life. And, we have to really weigh that out with each individual person. So thank you so much, Cassidy, for sharing all of this. Now, we've mentioned your Instagram throughout, but tell us a little more. Tell us about your Instagram, why you kind of started on there, and then, where people can find you. I know you're on TikTok as well. That's another one. So just kind of share, where can people find you? How did you get started on there? Tell us a little bit about it.
Yeah, I actually started my Instagram and my TikTok last year after I discharged from my 6 months treatment stay. I had my treatment stay at ERC in Denver. I'm open to questions if people always mention me oh my God, I'm going there. But yeah, so I discharged from treatment and I just wanted to continue to share my experience with ARFID. One aspect of treatment that I liked was I was able to share my experience for the first time with people who were actually willing to listen and willing to understand. whether that be with my team or just with other patients. So it was like 30 other patients, and we're all just like in this residential area. So I got to tell them about my experience for the first time and then validate it. It felt validating. So I wanted to continue doing that. I didn't want to go back to my life and just like hide in my own little personal shell and just like have nobody know about ARFID except for the people who are in my life. Just like obviously not as impactful as, the mass amount of people like you can reach online. So that's mainly why I started it. And it's taken off a lot quicker than I thought, honestly. And I'm just really, really happy. Like I said earlier, it's part of my mission to just like spread awareness on ARFID. And I just want to be a place where when you first hear of ARFID, my page comes up. My lived experience shows up, and I just want it to be a safe place for people to feel seen. When I first learned about what ARFID was from that YouTube video, I went to Instagram and to TikTok, and I didn't see a whole lot. And I feel like, especially for the younger community, is that the right word? I don't even know. The younger side of the world,
younger populations,
younger population, yes. They really, at least I really go to TikTok and Instagram for like validation, news. Like I learned so much from those platforms. So I think it's really, really important to have people on those platforms to help educate people. So, and they also teach you quickly, which I got that instant gratification. I like need to like learn like all this in like 2 minutes. So I think that that's mainly why I started it. And I just wanted to share my lived experience. And I also want to say, like, if you do go to my page, which if you're curious, it is ARFID Awareness, but it has 3 S's at the end. So ARFID Awareness, SSS. And my page is not about like being recovery focused, because I personally don't, for me in my journey, I don't believe that ARFID or that recovery for ARFID is real. I think that there's coping, but in my experience, I don't believe that there's something to recover, because I've always just been this way. So my page is all about being authentic and raw. And I don't want to say I post triggering things because that can come off like very abrupt, but like I'm just real with my struggles and I'm not filtered. So if that's something that you're curious about and you want to see more all about ARFID, like I said, my page, my Instagram and my TikTok are both ARFID Awareness with 3 S's at the end. And yeah, I'm super excited that I got to be on this podcast. It's so fun.
This was so fun. I appreciate you so much, Cassidy, and sharing your story and like, not only on TikTok and Instagram, but being open to sharing it on here as well, because I 100% agree that as providers, we need to learn more and more from people with lived in experiences, and, so that it can be limited. And I don't expect people to always share, their experiences, but I so appreciate you doing so. And thank you for going through my questions, all the things. Be sure to, if anyone wants the links to some of the things we've talked about, as well as Cassidy's page, I will have them linked on the show notes on my website, pediatricfeedingslp.com/podcast. So you'll be able to get those there. And yeah, I just thank you so much for your time today. I'm so excited to have this episode go out, which when people are listening, they're going to know it's out right now, but I'm so excited.
I'm so excited. Yes. And it's so ironic that Lauren's going to be, you said, on the next episode.
Yes. I cannot believe that. Like, just such small world for ARFID, which is why we have to really be listening in and learning more. And like you said, don't just rely on your textbooks to tell you. There's so much more to it. So thank you so much, Cassidy.
Of course. Thanks for having me, Bree.
Thanks for tuning in to the Feeding Pod this week. If you enjoyed today's episode, please don't hesitate to share this podcast with your friends and colleagues and leave us a 5-star review wherever you're listening from. If you're interested in learning more about pediatric feeding and swallowing, be sure to follow Bree, me, on Instagram at Pediatric Feeding SLP, or check out my website where you can get access to more courses and information, www.pediatricfeedingslp.com. Again, thanks for being here and listening to my ramblings, and I hope you'll keep listening. Until next time, cheers.